Welcome back to Namaste Radio right here on 99.5 FM on our iPhone, Android apps, on Amazon Alexa products, and on namasteradiohouston.com. I am now being joined by a very, very special person and also a very big supporter of Namaste Radio. That's right, I'm being joined on the phone with me right now, Dr. Namrata Sharma Goel at Kidney Health Center, has over 15 years expertise in blood pressure control, kidney stone and kidney transplant management, hemo and peritoneal dialysis, board certified in nephrology. Good morning, Dr. Namrata. How are you this morning?
Good morning, Sandeep. I'm excellent. Thank you. How are you?
I'm great. I'm great. Hope you're having a great weekend so far.
Yes, sure.
Yes, so tell us, Dr. Namrata, what is the latest COVID update right now and also the latest update on the Delta variant?
So the COVID rates in Houston and actually in the USA are rising again. This is actually our fourth surge that has started in the last 2 weeks.
Oh, wow.
And most of them are 90% of what we're seeing now is all Delta variant. And there are some gamma and some other variants also that have shown up in the U.S. and actually even in Houston hospitals. So it's out there. Other variants are there, and it's getting bad again. A month ago, I had no COVID patients in the hospital. And now they're, a few weeks ago, they were trickling in. And I have to say the last 2 days, they're just bombarding our hospital. I mean, every patient call I'm getting is a COVID positive patient.
Oh, wow. Oh, wow.
Yeah.
So are the numbers like kind of similar to where COVID was at its peak?
I would say the numbers right now of what I'm seeing in the ICU are close to what we were around January, February after the holidays.
Oh, wow.
It's there. It's not as bad as what we were last summer.
Yes.
But it has definitely a peak in another surge.
Oh, wow.
I continue to tell people, and they should never take their mask off because I've never taken my mask off. But they need to continue masking, social distance, and if you have to be around somebody, keep your mask on and try to stay about 4 feet away.
Yeah.
You don't have to stay 6 feet away, but it has to stay 4 feet away, right? So that's still very important.
Oh, wow. Yeah. Very important. Yes, definitely. And so we've been hearing these, seeing these articles, CDC saying possibly that we may need booster shots. How soon do you think people will need their booster shots?
Actually, the people need booster shots already, depending on when they got their second dose. Okay. What the FDA is going to let people do or give announce it basically in early September is that anybody who's had the second COVID shot within the last 48, before up to 48 days. So let's say if it's been 50 days or more, they can go ahead and have another booster for anyone 12 or over with Pfizer and 18 and over with Moderna starting September 20th. Right now, they're already allowing boosters for anybody immunocompromised, transplant patients on chemotherapy, or they have to take steroids for any reason, autoimmune diseases. So we've already started giving boosters to a lot of these patients. And the reason for that is all the recent data makes clear that this protection has, from these vaccines have decreased over time. And we have seen that. That's why we're getting a lot of these breakthrough cases. People who've had either vaccine are coming to the hospital or even staying at home, but they're getting COVID. That's because their immunity is not as strong as it was. Right. Because, some of us, like my second dose was January 8th. So I'm already 7 months out. So, our immunity, they're saying from an infection, let's say if we were 75 or 80% protected March, right now in August, we're only 53% protected from COVID. And on top of that, if we're only 53% protected from COVID, on top of that, the Delta strain is even much more stronger.
Oh, wow.
And that's the problem we're having. That's why we're seeing so much COVID.
Oh, wow, man. And so you mentioned earlier that people should mask up. Events now are kind of was coming back to normal. These indoor, outdoor events, and large number of people. But whether they're vaccinated or obviously unvaccinated, but even if they're vaccinated, you still think people should mask up?
Yes, whether you're vaccinated or unvaccinated, I think people should stay safe and stay guarded. I mean, I've heard and seen horror stories in the last 2-3 weeks, and it's no one to blame. This is our first pandemic, right?
Right.
We don't know anything about COVID, and we don't know. We had an idea we would need a booster. And just like the flu vaccine, the only reason we don't see flu in the summer is because we don't. It's just not the season. But that flu vaccine actually only lasts 6 months. So, October to March or February. I mean, I've had the flu in May because a variant just broke through, or, my flu vaccine ran on. But, it does happen. So it's like any other virus. It's just much more contagious than the flu.
Yeah.
And it's much more, virulent and stronger than any virus we've ever seen. Right. That's communicable, through the air.
Yes.
So it is happening, and I think people vaccinated. Of course, people vaccinated, we're not seeing them as much in the ICU, and we're not seeing them as sick. Now, they go home in a couple of days, or they don't come to the hospital. And it's most of the people that are in the hospital are unvaccinated. Most are unvaccinated. Now, unless they've got some immunocompromised issue, kidney problems, almost needing dialysis, they're obese, they've had heart issues. Then I have seen those people. I had a patient who had all of these, issues, and he only got his second dose like in February, but he had a really bad case of COVID, needing oxygen therapy, home oxygen. Now he's going on, at home, and who knows how long he's going to be on home oxygen.
Definitely should continue to be careful. Yes, like Dr. Namrata said. And so yes, you are a kidney specialist. You are board certified in nephrology. What are some of the basic things people can do to avoid any kind of kidney disease?
I mean, I would think, as keep yourself healthy, keep your weight low, keep yourself, eat well, keep your sugars low, your blood pressure maintained.
Right.
These are I think it's more an all-rounded fitness that keeps your kidneys and your heart healthy. If your heart is healthy, your kidney will stay healthy. And don't take a lot of pain medicines. People are constantly popping Aleve, Motrin, ibuprofen. All of these things over time hurt kidneys. The better drug of choice would be Tylenol as needed if you have to take something.
Yeah, that's definitely my go-to. If I'm in pain of something, Tylenol is my go-to. So yes, which locations, if you want to tell our listeners about your locations and also the number for appointments.
So I do have a clinic in Sugar Land, and a medical center, and you can always call 713-520-6875 for appointments. We are doing in person for anybody who wants to see me in person. We are also offering a lot of people virtual visits, whether it's for the distance or people just want to stay home and they're compromised. So we also do Zoom calls, and that are very Medicare allows us to do that legally. So it's we call it HIPAA proof, so that and it's full of confidentiality, that your medical records won't be released through this portal. So we do full confidentiality even on video. So people should feel free to do that and call me at 713-520-6875. And for any kidney problems, swelling, whether the legs are swelling, shortness of breath, high blood pressure, pregnancy-related, protein in the urine, diabetes-related, autoimmune diseases, anything like that, I am a specialist for that, and I can help them out for that.
That's right. That's 713-520-6875 for appointments. Before I let you go today, anything else you'd like to say to our Namaste Radio listeners?
I think that, guys, the pandemic is not over. It is our fourth surge, as bad as the others. And now our immunity, our vaccinated people, we're not safe. Our immunities are running out. And until that booster provides us that extra 5 times burst of immunity is what, the research says. I think we should all, stay safe, keep masks, keep, socially distance as much as we can. And hopefully we should, finish this pandemic, hopefully this year, if not, early next year.
Yes, hopefully soon. Well, Dr. Namrata, thank you so much for taking time out of your busy schedule and speaking with us here on Namaste Radio. I hope you have
Of
a
course.
great rest of your weekend.
Thank you. Thank you for having me. Be safe.
Thank you.
Bye-bye.
Thank you. Thank you. Yes, that was Dr. Namrata Sharma Goel, kidney specialist, board certified in nephrology. Again, for appointments, 713-520-6875. That's 713-520-6875. Enjoy this next song right here on Namaste Radio. Keep it locked.